Epilepsy and seizures. So this is our lecture's topic. First of all, we should know about the seizure and epilepsy. That what is seizure and how can we differentiate between both of them? So seizure, by definition, we can say that seizure is the abnormal electrical activity in the brain which produce motor, sensory or psychomotor effects. So abnormal electrical activity in the brain which produce abnormal motor, sensory or psychomotor effects. These effects that is produced due to the abnormal electrical activity will be abnormal effects. So this is the definition of seizure. Now how can we define epilepsy? Because every seizure is not epilepsy. So we can say that when the abnormal electrical activity in the brain which produce abnormal motor, sensory or psychomotor effects repeat again and again, so then we can call it epilepsy. When these effects repeated again and again, so we can then call it epilepsy. So now we are going to talk about the effects which can be motor effects, sensory effects or psychomotor effects. So what can be these effects? If we talk about these effects may be local or focal and can be generalized. It means that these effects, like motor effects, can be focal and can be generalized. Focal means that these effects will appear at some body part and not at all body. But generalized means that these effects, mostly motor effects, will be all over the body. So now these thing have discussed that according to the whole body are local effect. So the seizure may be focal or generalized. So we are now going to talk about the effects which can be motor, sensory or psychomotors. So in motor effects we can say that it can be, the seizure can be tonic. In this type of seizure, the overall body or the focal, if we say about the focal effect, the muscles at that focal area will become tonic. And if we say about generalized type, the muscle of the whole body become tonic when the seizure attack start. So this is the tonic type seizure, that all over the body muscle, if the seizure attack is generalized, will be tonic or contracted suddenly. The another one type is the clonic seizure. So in clonic seizure, there will be a jerky effect at focal area if the seizure is focal type of seizure, and in the all over the body the jerky effect will be all over the body, and all over the body if the seizure type is generalized. So the difference between tonic and clonic is that in tonic the muscle will be contracted immediately, while in clonic the muscle will be contract and then relax immediately, so it will yield a jerky movement. Now the third one is the clonic tonic. In clonic tonic type seizure, there will be the tonic effect, that is the muscle will be contracted immediately, and after that there will be clonic effect, which means that after that there will be jerky movement started. First there will be, if we say that in clonic tonic the muscle will be contracted or become tonic, and then there will be, after that there will be a jerky movement, so we can call them clonic tonic seizure. It means that these two type, there will be a seizure of combinations of these two type of the seizure, so we can then call it clonic tonic seizure. And if we say about the sensory effect, in sensory effect there will be some visual disturbances if the seizure attack become start. Any visual, in sensory we have discussed that there will be, in sensory effect there will be sensory overactivation, which can be in the form of any visual or in the form of any auditory, or can be in the form of any olfactory. So it can be in these form. And if we say talk about the sensory effects, so if we talk about the psychomotor effects, there will be any sexual effects that will start suddenly when the seizure attack become start, or there will be any sexual effects or any type of GIT abnormalities like cramps, which can produce diarrhea, abdominal cramps. So these can be these type of effects can be observed in the psychomotor effects when the seizure attack become started. So these are the effects, motor, sensory and psychomotor effects that will produce in the seizure. Another type of seizure, if we talk about, as the absence seizure. This can also a type of seizure in which there in absent seizure there will be a sudden loss of sensation or awakeness for a short time, and then the subject will become normal after a few minutes or after a few seconds. So this is the another one type of seizure. We can also say about the seizure that there can be one type of seizure that is benign Ronaldic, benign sorry, Rolandic type of seizure. In this type of seizure, the seizure attack become resolved and the subject become normal after the late year of age. So that's why this is called the benign type of seizure, that the subject become normal as the age become grow. So this is called benign Rolandic seizure. So the another one type which we can say the syndrome of the seizure is the Lennox-Gastaut syndrome. In Lennox-Gastaut syndrome, there will be a combination of mostly all type of seizure. It means that the combination may be atonic, tonic and atonic and tonic and clonic and tonic clonic. So in Lennox-Gastaut syndrome, there will be a combination of multiple type of seizure. So the fourth one can be infantile spasm, which we can also call it West syndrome. This type of seizure is present in the infants, in which the infants feel sudden jerky type movement of all over the body for a short time and then become normal, and we can also call it West syndrome. So these were some extra knowledge about the seizure, in which we have already discussed that the effects may be sensory, motor, or psychomotor. So these are syndromes and maybe other types of seizure just we have discussed. And in next video we will upload. We will try to discuss the treatment protocol and videos of each type of seizure and treatment approach to each type of seizure through medications. So stay with us.